Hello everyone, Tanya Siddiqui here, and I am an educator with a lot of experience managing schools and childcare programs. I am also a Canadian certified childcare licensing officer and an alternative healthcare practitioner. Today's episode is about reactive attachment disorder, which is a very serious type of mental disorder and needs to be addressed as soon as possible. It originates in infant and toddler stage. Children need constructive, positive, responsive relationships with their primary caregivers, and primary caregivers are mostly moms but could be dads, grandparents, aunts, uncles. Sometimes children are not able to form these secure, positive emotional bonds with their primary caregiver. In other times, these bonds get broken or early years get disrupted, and that leads to children developing reactive attachment disorder. Children with reactive attachment disorder are usually unable to meet their developmental milestones, are unable to manage their emotions, and often appear sad and irritable. As I said before, that this is a very serious health problem which needs to be addressed as soon as possible, because if it remains untreated in childhood, it can lead to other serious mental health issues such as in adulthood, such as not being able to maintain harmonious relationships with other people, depression, anxiety, and more serious social and emotional problems. In this episode, we are going to look at early warning signs, what are the causes, how to support the health of these children with reactive attachment disorders, and what techniques can be used to help children to overcome reactive attachment disorder. Now let's look at the early warning signs. The infants show no response. They do not engage in social interactions. They don't smile. They avoid eye contact, and they do not reach out to be picked up and do not react by making sounds. The toddlers show no interest in playing games or in toys, and they spend a lot of time rocking or comforting themselves. Older children tend to have underdeveloped conscience. They lack empathy. They do not show any remorse or regret for hurting a child or pet, and they experience difficulty displaying affection and care. These children often have control and anger issues. They tend to ignore instructions, often use silent treatment. They push limits by not stopping a disruptive behavior immediately, even when asked to. They lash out with anger when reprimanded and refuse to apologize. All children need a nurturing, caring, and loving environment with a caregiver who is able to meet their physical and emotional needs consistently. And some of these needs are love and care, safety and security, food, clothing, protection, stability, emotional support, structure, predictability. When caregivers are unable to meet children's needs in a consistent manner, it can lead to mental disorders such as reactive attachment disorder. Let's look at the causes for RAD in details. So the caregiver is not responding to baby's cries, a baby whose diaper is soiled and not changed for hours, a baby who's lying hungry, a baby who is crying in distress, a baby who is not held, touched, talked, or interacted with for hours at a time. And also when the child only gets attention when displays extreme behaviors. A child or baby is mistreated or abused emotionally or physically by the primary caregiver or by another adult, and an infant or young child is separated from caregiver or has moved from one foster home to another foster home, and the primary caregiver is emotionally unavailable due to hospitalization, substance abuse, or any other reason. Now let's see the consequences of untreated reactive attachment disorder. Children tend to have developmental delays. They usually have eating difficulties that can hinder with physical growth. They also suffer from emotional problems such as depression, anxiety, and anger management issues. They also suffer from substance abuse and behavioral or learning problems at school. They also are unable to maintain and build collaborative relationships with friends and with partners and spouse later in life. Children with RAD can exhibit inhibited symptoms of RAD or disinhibited symptoms of RAD. Children with inhibited symptoms of RAD are usually withdrawn and emotionally unresponsive. They may not show or seek affection from caregivers or others, and they may keep largely to themselves. Whereas children with disinhibited symptoms of RAD are overly friendly towards strangers, often in unsafe ways, and prefer strangers over their primary caregiver. In repairing attachment disorders, the first thing is to identify the problem. The symptoms of RAD closely matches with those of autism spectrum disorder. However, autism is a developmental condition that affects behavior and communication, but it is not caused by childhood abuse or neglect. Therefore, the history of the child is important in differentiating the two. The second thing is responding to the child in loving and caring way. The aim is to fill the emotional void that is created in infancy. This may require lots of patience and care. Then helping the child by seeking treatments that we would be discussing next, and also listening to the child, talking to the child to emotionally connect with you. Communication is the best therapy, and giving quality time to the child by playing and doing fun things together is very important. This is a serious mental problem and it would require professional interventions. And some of the techniques that work wonders with this disorder are family therapy, individual psychological counseling, play therapy, special education services, and parenting skills classes. I would be compiling a list of resources available in BC, Canada, and would be uploading them to my YouTube channel soon. That's all for this video. In the next video, I'm going to talk to you about narcissist personality. What is narcissist personality? Are children born with this personality or they acquire it later in life? And what are the traits? What are the symptoms? What are the causes? And what we as early childhood educators and parents can do to instill empathy in children. Thank you very much for watching this video, and please do not forget to like and subscribe so that you can get my videos as soon as I upload them.